Welcome to Strange Side Effects. A bit of a mix in this one that patients can experience. Now, some side effects are predictable based on the pharmacology and mechanism of action, and some are just plain weird and understandably difficult for the patient experiencing them. We are going to go through some of them now and the reasons, if known, why they occur. I'll try and include pictures if I can. If not, I will do my best to describe as much as possible. First off, we have black hairy tongue, or lingua villosa nigra. Yes, some medications can cause what looks like a black hairy tongue. Now, although this sounds very strange, it's not as bad as it sounds, and it's completely reversible on withdrawal of the offending product or medication. It's caused by an enlargement of the filiform papillae, which are tiny bumps on the surface of the tongue, and can grow to 18 millimeters in length. It's due to defective shedding of surface cells. The abnormal length creates a debris of bacteria and yeast, making porphyrins, which are coloured compounds, giving the discoloured appearance. It's rare in infants, but more common in those over 40. It's been linked to medications such as penicillin, erythromycin, tetracycline, doxycycline, lansoprazole, olanzapine and bismuth. The list is on the screen there. It can also be aggravated by poor oral hygiene, so brush your teeth and floss. This is not the best side effect. I mean, it's not ideal. I've never had somebody come back to me asking, what's happening to my tongue? I'm kind of disappointed about that, but maybe one day, and I will be ready. Number 2, musical ear syndrome. This is a condition where patients have auditory hallucinations, but in the form of singing or music that isn't there. It's mostly experienced by those who already have a degree of hearing loss. Medications linked to this phenomenon are antipsychotics, antidepressants, and antiepileptics, and donepezil. Now, some medications are ototoxic, meaning they can cause ear damage, resulting in symptoms such as tinnitus or balance problems, such as aminoglycosides and macrolide antibiotics and loop diuretics and NSAIDs. But this differs from musical ear syndrome, where patients have reported to hear whole symphonies or hymns, even Christmas carols. Weird. 3, purple glove syndrome. Purple glove syndrome is rare, but it's a serious side effect associated with the intravenous administration of certain medications. For example, the chemotherapy drug doxorubicin. This is characterized by a swelling and discoloration of the hand and arm where the medication was administered. This affected area can turn blue or purple, and the skin can become painful, swollen, and tender. This can also lead to loss or function of the limb. It typically occurs when the medication leaks out of the vein into the surrounding area, causing damage to blood vessels and surrounding tissues. This can lead to necrosis if not addressed promptly. Gynecomastia. Certain medications, including some antipsychotics and antiandrogens, can cause abnormal breast tissue growth in males. This is called gynecomastia. It can also occur due to hormonal imbalances and underlying health conditions. Whilst it's not harmful, it can cause extreme embarrassment and discomfort for some individuals. So some medications can disrupt the balance of hormones in the body, leading to an increase in estrogen levels relative to testosterone. This hormonal imbalance can stimulate breast tissue growth in males. And we also have direct stimulation of breast tissue. Some medications directly stimulate breast tissue growth by interacting with estrogen receptors and other pathways involved in breast development. I wouldn't be too mad at this, but some people just aren't amused. And lastly, we have inhibition of androgen action. Medications that inhibit the action of androgens, male hormones like testosterone, can indirectly promote gynecomastia by reducing the suppression of estrogen effects on breast tissue. And some of the examples of medications are shown on the screen. So that's the end. Thank you everyone for watching. And if you want to see more of this, just let me know. I have so many of these. Thank you.